I'm Tony Esselin.
And I'm Amy Bernard.
And we are here to help make it make sense.
This is the podcast that takes complicated science and breaks it down into easy to understand language.
So buckle up, buttercups. You are in for a bumpy ride. All right, you guys, we are super excited to share with you that this podcast episode was brought to you by Shared Harvest and Together Towards Health, a community grant with the goal to support community-engaged discussions around COVID-19 in society and to educate our children and families about COVID-19 vaccines for pediatrics. For more information, go to www.sharedharvestfund.org or call them at 323-880-0121.
So the Shared Harvest is here to share the facts, debunk myths, provide vaccination appointments, and address your concerns. You can trust them. Their providers are parents too, and they know exactly what you're going through. Stay tuned for new topics that help guide you towards healthier decisions for you and your family in tackling COVID and getting vaccinated. Together, we've got this.
All right, everyone. Welcome back to our very fun and exciting podcast. Help Make It Make Sense with Dr. Tony and Dr. Amy. We received a request to talk about the state of emergency. And so we wanted to go over that with you guys. So like, what does that mean? What are we talking about? What are all these words? And what does that actually mean for those of us who are out in the community?
Yeah, so and I would further that with, we were asked to talk about not only the state of emergency, but what does it mean when it's ending?
Yeah.
Yeah.
So we're going to go ahead and let's start with some definitions like we like to do to make sure we're all on the same page. And we'll take it from there. So first, let's understand what a public health emergency is. And in order to do that, we'll define what public health issues could be, and then also define then what an emergency would be in that context. Mm-hmm. So a public health issue is one that affects a significant portion of a specific population. And so according to the WHO, an emergency describes, quote, a state that demands to be declared or imposed by somebody in authority who at a certain moment will also lift it. That's end quote. It is usually defined in time and in space, and it requires threshold values to be recognized. So what that means is there needs to be some type of guardrail or border around what is this emergency? It started when, and like at what point is the end? It's a defined space. It also implies rules of engagement, an exit strategy, and mobilization of resources and budget. This is very important. This is the part that actually affects us as the population, because it dictates what resources we will now have or not have at our fingertips, be able to respond to the issue when there is no declared emergency, right? And so this actually comes from the WHO Glossary of Humanitarian Terms, which was written in 2008, and you can find it online, and I'll leave it in the show notes for you guys to review.
So for English for me, this really just means it's like a state of emergency that will be put in place by the people in charge, like the White House or like the World Health Organization, things like that, and that they will start it. They will provide funding and resources and kind of manage the whole thing. And then they'll also tell us when it's done or when they think it's over, correct? So from start to finish and all the stuff in between.
Right. But I think the part about the definition for me that stood out is the fact that a part of this includes an exit strategy.
Yeah.
Because an emergency doesn't last forever.
Right.
If it does, then it's called a crisis. Then it's something different. Right? Yes. But if we're calling it an emergency, then it is something that has a beginning and it has an end.
Right.
And so so that's part of this conversation.
Right. And the exit strategy would hopefully be something that would allow people to kind of slowly go back to the norm.
Or what they thought was the norm.
Or what, yeah, exactly. Or what they hope the new norm will be. Yeah. Okay.
Let's say they now adapt the good things that came out
Mhm.
of that situation
Right.
and integrate it into a new standard of being.
Yes. I like that. Okay. I like your definition better.
Thank you. Thank you. So for us, what does this mean? And so for us, a public health emergency was declared by the Secretary of the Department of Health and Human Services in late January 2020. So that's our people. These are the folks that deal with the United States. We're just talking about the United States. This is not a global conversation for right now. This is a US-based conversation. The public health emergency in the United States will last for 90 days, and it must be renewed in order to continue. The public health emergency for COVID has been renewed multiple times, and most recently in February 2023, and it is currently scheduled to expire on May 11th, 2023. So that's the public health emergency piece of this.
Yeah. So we're talking May 11th. That's less than a month away.
Yeah, that's right.
Yeah.
Well, and then in all fairness, you know, they announced this in January.
Yeah, no, I know.
At the end of January. Yeah, it goes by fast. But and they have to like let you know ahead of time so that you can start getting prepared for what does this mean, so we can have this conversation here on this podcast. Like it was literally for us. We can have this discussion. Okay, so what I learned through this whole process is there are multiple declarations of emergencies in different sectors that mean different things. So this is public health emergency. Then there's the National Emergency Declaration that was issued by the former president in March of 2020, the US president. A National Emergency Declaration is in effect unless terminated by the president or through a joint resolution of Congress, or if the president doesn't issue a continuation notice annually. So the national emergency sits squarely with the president. So such a notice was issued by the previous US president to continue the emergency beyond March 1st, 2021, and by the current US president to continue beyond March 1st, 2022. And recently on January 30th, 2023, the Biden administration planned to extend the national emergency up until May 11th, 2023, and then end on that date. So that's what that means. Now, separately, and I thought this was a good one to just bring up. There are others, and this is the last one that I'm going to bring up because I think it's important. We've been tossing these words around when it comes to vaccination and medications. And so a separate emergency declaration is made or was issued by the Secretary of Health and Human Services in February 2020. And this was specifically with regard to the emergency use authorization that we talked about. And that was done on March 27, 2020. Now, remember that emergency use authorization is a measure that the Secretary of the Health and Human Services can make in order for medications, vaccinations, what they call countermeasures for the threat that we're ever experiencing, can basically get approved to be used because there's nothing else out there. That's the best that we got, and the benefits outweigh the risks. And so again, it's a mechanism to facilitate the availability of medical countermeasures, which is vaccination, medication, treatments, care, right? That are determined to be safe and effective, but have not yet been formally approved. An emergency declaration that is specific to the FDA for the use of medications and vaccines to treat COVID remains in effect until it is terminated by the HHS secretary. And the timing to conclude the EUA is yet to be determined, is my understanding, and it will not conclude on May 11th, 2023 with the other declarations. That actually makes sense to me because medications are still out there floating about, and they still need to be approved, like
Right.
officially. So there would be no way to just end it because the president said so. Like, that's ridiculous, right? Like, that's a science thing, and we need to like let science do its process.
Right.
And then we can, that just needs to go from EUA, which is the emergency use authorization process, to the approval process. Like, all the medications and vaccines that have come out under EUA just need to now go through the approval process. So they will all have their own end date when they become approved. Okay, so there is a separate declaration that I think is important to go over, because we've heard about EUAs in the media and all about vaccination, that has to do with medications and the vaccines, right? So a separate emergency declaration was issued by the Secretary of Health and Human Services in February 2020. Based on this declaration, the Secretary decided to justify the emergency use authorization. And that is used specifically by the FDA for medical countermeasures, or that's fancy word for medications, vaccinations, any product that is supposed to treat, manage, prevent, address the threat that is coming, that we're trying to fight. And so they issued one on March 27th, 2020, specifically for COVID-19. And that EUA is a mechanism, remember, to facilitate the availability of these things. So there's usually a lengthy process for medications, vaccines, any kind of products that we're going to consume in order for them to be licensed and approved by the FDA. This says, hey, guys, there's nothing else out there. The studies look good for right now, and people are dying, and they're dying fast, and we need to do something, right? And so the HHS has the secretary of HHS has the ability to just say, hey, this is not a normal situation. We've got to do something. Let me declare an EUA. The data looks like it's good, and people are dying. So we have to keep it moving. Let's go. And so that's what that declaration is about. Now, this will remain in effect until the HHS secretary says that's enough. That is so this is not dependent on the president. This is not dependent on, the declaration of a public health threat. It's nothing like that. It has to do with the Secretary of Health and Human Services in the United States making the decision that they're terminating the emergency use authorization, or if they're going to issue more. For whatever reason, they have the power to make that decision. And so anything that is remaining under the EUA at the moment is going to go through a transition process, again, according to what the Department of Health and Human Services decides. And it has nothing to do with the declarations ending on May 11th, 2023. It's a completely separate process. And so I just want to make sure that you understand that. So anything that's under EUA will continue, and if it gets terminated, it's because it's a different decision mechanism. So hopefully that didn't confuse anybody, and that's clear. So that
and let me just talk about this in the context of like the COVID vaccines that are now under EUA. They are going to go through the full-on regular approval process, because we know that some of the COVID vaccines all of them were originally under emergency use authorization to make sure we could vaccinate people and stop the deaths, stop the hospitalization, stop the death, stop the dying. So those that are under EUA, like you said, transition to the approval process as normal. And some of them have already transitioned and been approved. So those that are under EUA are being moved to the approval process as normal. So yeah. Excellent.
Okay, so that we wanted to give you the context of what this emergency means, and like understand what the dates mean, and before we can move on, for you to ask, what does this mean for me? So I thought it would be important to just tell you what the state of COVID deaths are at the moment, so that we can understand exactly where we are, right? And so as of April 12th, this is what I just looked up for this podcast, the CDC reported that in the United States, there were 1,327 deaths a week, which is close to about 200 deaths a day, more than 2 times that of influenza. And you can look this up on the CDC website. I will leave the CDC websites in the show notes. But that's not small.
Can I ask you a clarifying question?
Sure.
When you say the 1,327 deaths, are those all attributed to COVID? Those aren't like nationwide deaths. Those are COVID.
No, this is COVID specific deaths.
Got it.
Yes.
Wow, that's still a lot.
That is a lot. That is a lot. Okay. And it's blowing influenza out the water, honestly. Yeah. Unfortunately. So, you know, it's debatable, and it has been debated as to whether or not this emergency really truly is over. But I think that where we are is that we have everything at our disposal that we can have at this point in time to be able to try to fight it.
Yeah.
And so you are doing everything you can. If you've been vaccinated and you're up to date with your vaccinations, and up to date means primary series and that word that we don't like, but we're going to say extra dose.
The additional dose, AKA booster.
The additional dose, also known as the booster. If you've had all of those, then you are up to date. You've done as much as you can. And then the other part of the conversation that we don't talk about enough, and we'll hopefully dedicate a whole podcast to this, is about the fact that COVID can be treated. There are treatments out there, and they are underutilized. They are underutilized. And so, you know, for those of us who get it and are really, really sick, you can get antivirals to try to help you, you know, get through it.
Yep.
And there are medications out there. They are under emergency use authorization, but they have been demonstrated to work. There are a lot of caveats. We'll go through therapeutics in another podcast. Yeah. But you just, now you know. And so if God forbid it happens to you, you have to ask your doctor, like, hey, what can I use to treat? Like, go and ask them, because it's not coming. It's not being, I guess, offered as often as we would like for it to be offered. At least here in like New York, I can say that, you know, we need to do a better job of offering it to folks who actually really need it. And so,
yeah, so I think we're in a very, I mean, you know, obviously if you and I were making the decision to lift the emergency, we might think differently as an immunologist and a med peds doctor. However, I will say that, like you mentioned, we have a lot of tools in place that we didn't have when this first started. We have a lot of different, we have multiple options of vaccine offerings. We have like the antivirals. People know that, you know, in certain situations, they should wear masks. So I think that we have a lot of information, and we've learned a lot from the pandemic. And I think also, I have also learned through this process that pretty much everyone that I know who's not in the medical field, and even some who are, they're just kind of, you know, doing things like they did before March 2020.
Yeah.
So I feel like I feel like a lot of the United States has kind of lifted the emergency order kind of on their own, just in their social, just the way in which they socialize. And I, you know, and I think because we have the tools, we have been able to do that.
Yeah.
You know, so I feel like, this could also be in response to just looking out your window and seeing what people are doing. You know what I mean? So I think it's tools, and then also just how people are acting. So yeah. And I will also add that I feel like even before May 11th, which of course we're not there yet, but for many months, it seems like a lot of people were like, what? The pandemic is over. I'm like, no.
Yeah, we will continue to say the pandemic is not over. I'm not ready to say it's over yet. So I'm not going to say that. It's still a threat, especially for those who are the most vulnerable.
Right.
Those those are the ones that we are worried about,
Well,
right?
I mean, 1,327 deaths a week due to COVID to me does not scream this is done.
Yeah. Now, mind you, we're not we are at the end of the respiratory season. So I'm afraid for the fall.
Yeah,
like,
no, I know. I
like
know.
last year in the summer, there was a variant that came out that terrorized us in July. So we never,
Yeah.
we just don't know. We're still learning.
And
We don't know what
new variants keep coming. Like the Omicron was like a big variant, but there are a lot of like great grandchildren of Omicron that are wreaking havoc across the globe. Like they keep different, versions or variants of Omicron keep coming. And I've been hearing about some new ones, and not to give like people endless numbers of letters and or endless names of letters and numbers, the XBB 5 point, there are new ones. I mean, I just heard on a podcast that I frequently listen to that one of my personal superheroes, Dr. Michael Osterholm, is the host of, just talked about, the most recent variant that's kind of wreaking havoc over in India. It's an Omicron variant that seems to be more super contagious, and his whole podcast was talking about, it's probably coming this way. So I agree with you that we are not out of this.
It's probably here. What are you talking about? If it's in India already, it's here.
I mean, yeah, it probably is, but yeah, I mean, I think he and others that had not yet had it, people are still susceptible. So anyways, yeah.
So that's what this is, the context. This is where we're living. We're here to just give you the context and help you understand how you're going to move world with all of this pressure and all of these things that are coming at you, and try to give you as much information as you can handle in order to like get through it. And so some specific questions that we want to run down to in terms of like what does this mean, right? What does this mean? What is all of this stuff that we're talking about?
What is the end of this emergency?
Yeah. What
Public health emergency, PHE. What does this mean?
Yeah. And so, does it mean that there are no more mask mandates? Well, I mean, I don't think, because there's no federal level of emergency that's going to end, that there won't be any federally mandated mask mandates. I think that there may be some for local businesses, maybe some healthcare facilities, crossing my fingers.
I know. Let's hope. Let's only hope.
Like hoping that in healthcare facilities, folks are masking up, because that's where sick people go. And I would recommend, if you go into a healthcare facility, you mask right up, because you don't want to, I have to say, I still see patients and people are just coming in with no masks, and it's like, I wouldn't do that if I were you.
Yeah.
But, our recommendation would be that, if you're going to a healthcare facility or anything like that, you should stay, you should continue to wear your mask to protect yourself and your family. But I don't think there won't be any mandates from the federal level. Amy,
no. Yeah, I would also say that, I think it comes down to, if you want to protect yourself in certain situations, like as an example, we recently flew for spring break, and I think we were probably of the 5% that wore masks, my family. I actually asked my kids and my husband, I'm like, looking around, do you think it's 5% of the people, 10%? They were like, 5 is probably realistic / a high percentage.
Yeah.
But I will still wear it when I am on an airplane or in an airport where I'm around people that I think have been all over the world.
Sure.
But and I think people who are immunocompromised or on chemotherapy, like, I would recommend that you still use it. And I hope that if somebody were to see people wearing a mask, that, they're like, why are you doing that? This, we're out of the, like, I think it should be, when people on different sides of the political spectrum are like, it's all about choice. Well, guess what? I can choose to wear my mask. Okay.
There you go. I think that's right. And
And you can choose not to, okay?
right. But the point is that like there will be some local places that will ask you to wear a mask. And I think that those will be respected, but that's not going to be a federal mandate. And just because it's not a federal mandate doesn't mean that you shouldn't wear it or honor that if somebody's asking you to.
Right. Be respectful and honor that if you're walking into a healthcare facility filled with a bunch of very, very ill people.
I would advocate for that in a healthcare facility.
So
no more, does this mean no more vaccine mandate for school-aged children? So I believe that mandate was dropped a while back. I don't remember. But what I would say is as long as the vaccines are under the emergency use authorization, there's no way to get it mandated. And we're not finished. We're not through that process yet. There are some that are approved. There are some that are not. You know, we need the dust to settle on that before they're going to be able to mandate it for school-age children at this point in time. So and
my understanding here in Colorado is that for school school entry immunizations, that the only types of immunizations you can add to the school entry required immunization list are those that have been fully approved. And here in Colorado, it doesn't mean that, and each state is a little bit different, but it doesn't mean that all of them are on the list, but they certainly have to be approved and not EUA. But as we just mentioned, EUA means that they are going to transition from the EUA through the approval process with the hope of being approved.
Right. Okay, the next question. So if this has been lifted, if the emergency ends, how do we prevent infection in our children?
Yeah.
If they have not gotten vaccinated, get them vaccinated. That's number one. That's number
one. Go out and get your Band-Aid.
Go and get it. Go and get it. Right now, the recommendations are 2 shots of the primary series and then a additional dose or booster shot. And that is how you are characterized or identified as being up to date. So 2 shots, 2 primary series, and then a third booster / additional dose.
What are you on? I'm just curious. I have had 5.
3. I think I've gotten 5. I think I've gotten 5. I don't remember. I don't know. I've gotten so many.
I keep my vaccine card in a special holder that I bought. That is it's a Harry Potter vaccine card holder. I know. And it's got a little clip and everything, and it's super cute. But anyways, I am on 5 and I'm looking for a dealer to give me a 6th.
You're hilarious. So God. I'm not quite that anxious to get another one, I got to tell you.
Well, I'm 6 months post my 5th one, so I know their antibodies are starting to wane.
Yeah.
Anyway, sorry. I wanted to.
Yeah.
No anytime problem. I can talk about vaccines.
I know. And you've resisted a PowerPoint up until this point. So
my God. Oh, did you ask? Are you requesting?
No.
Oh.
No. Yes. So if your child is not vaccinated, you're again, go ahead and try to get them vaccinated or ask us questions if you're concerned. But the other idea is that they should wear their high quality masks wherever they go, especially in a densely populated indoor area. And even if you're outdoors, these new variants are contagious, so if you're outdoors and close, you could still, there's freshly coughed pockets of air.
Freshly coughed pockets are everywhere.
They're all up in your face, even if you're outdoors, if you're close, so, kids like to roll around and lick each other's faces. So, there's that, right? Wash your hands, normal hygiene things, wash your hands, sing ABC. I sing ABC, with my son to get him through washing his hands correctly, cover your mouth when you cough, sanitize, all those things.
Mhm.
Other ways to prevent infection, but your best bet, honestly, is just get vaccinated. It's actually the easiest thing to do.
Yeah, and remember the way that I explain the vaccines, you know, we know at this point that they're not completely preventing infection, but we know that just like they work like a seat belt,
Yeah.
right? They may not prevent the crash, so you might become infected, but they'll prevent serious harm and injury, death, and in most cases, hospitalization. So get that seatbelt on, that COVID vaccine seatbelt.
Get it on. Next question. Does the government plan to add COVID-19 vaccine to the list of 10 vaccinations children are required to have to attend school in person? I think this is an awesome question.
Mm-hmm.
I suspect in the future, yes. When the EUA is completely lifted and vaccines are licensed, they've gone through the transition process.
Yep.
And they're completely licensed. I suspect that they will be added, but I don't. Time will tell, because we're still in a phase right now, in a transitional phase.
Right, and I agree with you. I think it seems likely because I believe that all these, you know, several of these COVID vaccines have gone through the approval process and have been approved. I think that it's likely that all of them will transition through the approval process, and I agree. I think that they will also likely get approved. So for all ages and whatnot. I also think that SARS-CoV-2 is here to stay. I don't see it as magically disappearing. So it's become endemic, meaning that it's like kind of part of our communities, right? So since it's not going away anytime soon, it's still causing death. I think that probably will be added to the annual vaccine immunization schedule, but this is where it's going to be. Oh, damn it. That's my doggy. Did you hear my doggy? Oh, okay, good. So this is where it's going to be.
I did hear you say "damn it."
I know. Ooh,
cut that out.
we're just lucky it wasn't an F-bomb. I do have teenagers at home. And I'm like, okay, I know that you enjoy me as a parent, but please don't use the F-bomb in front of me. But anyways, I think so different states will have, there's differences in school entry immunization, what's on the list. Because I know as a vaccine advocate in Colorado, I play a role in usually testifying in support of the pro-vaccine, pro-science policy at the Colorado Board of Health and also at the Colorado State Legislature. So it can vary, but like Dr. Tony, I think that it's likely that this will be added to the annual school entry immunization requirements. So I'm hopeful that it will happen.
Agreed. Okay. What if I don't want to vaccinate my child? Can they go to school? So at the moment, again, I don't believe it is required. But when the time comes that it is required, it may be true, unless they fulfill exemption status.
Mm-hmm.
And what will be accepted for exemption has yet to be determined, as far as I know. Mm-hmm. Once it goes through the whole committee and approval process, then they'll have a whole list of what they recommend, what they need to do, and what is going to qualify for exemption.
So that also varies by state.
Yeah.
And the reason why I know that is because Colorado is horrible, as in fairly easy to get an exemption. Any exemption you can think of. Personal, medical, religious, whatnot. Those are all available here in Colorado. Recently, I did support a common sense bill where it was called SB 20, I think 263. This a couple of years ago, but it was essentially to require parents or guardians to fill out an actual form, just like a one-page form for their exemption to check the boxes and whatnot. That is kind of it's slow on the uptake, but that was kind of a nice addition. Because prior to that, they could just like write on any piece of paper, like my kid's exempt, and just like hand it over. And it was not any big deal. But so exemptions vary by state, and some states have much more stringent requirements for exemptions. And some states do not. So that just is variable. Yeah.
Yeah. Yeah, I have to say, I've said this before in other podcasts. I'm not gung ho about mandates because I feel like they're in place because we have a deeper problem in our healthcare system where folks just don't trust. And if we had a better system and were able to build trust in our communities, there would be no need for these mandates because people would just be like, oh my God, this is good for me. I know that this is meant with goodwill, I'm just going to go ahead and get vaccinated, but we're not in that space.
I agree. I would also say, I think that, the other deeper issue is I think a lot of people don't think of us as like a community of human beings that take care of each other.
Right. Yeah. You've said
right?
that. Yeah.
So
You've said that. Like that's the problem. We don't consider ourselves a collective.
Right.
We're not a collective. We're
every
man for himself, and it's sad.
Yeah, no, I agree. This makes me think that it would be really fun to look around. Where was it that you had that interesting cab ride?
California.
We should do a field trip looking for your taxi driver. I don't think we have to search far and wide to find people that are similar to the taxi.
No, it's just really unfortunate. It
is. There's more to it.
And I just wish it was more like, like the no's were really because, there's like a medical problem. They had a reaction, like something like that.
Yeah.
But as opposed to like, nah, I don't trust that.
And I mean, I will say that for medical exemptions, I think that those are important. I don't think, because people have said to me, well, you don't want any exemption. I'm like, no, that's not true. I think that if there is a medical exemption, absolutely, that should be in place for sure. 100%. I just think that we should think of ourselves as a collective of, humans that are helping each other and shielding those that can't get vaccinated for whatever reasons, like a medical exception.
I agree with that. We have a long way to go.
Yeah.
If the public health emergency is ending, does this mean that resources for COVID-19 are going away? Oof. A big fat oof.
Yeah.
Unfortunately, yes. Unfortunately, yes. There are going to be changes in health insurance coverages. So please, please, please pay attention to what insurance plan you have and what will and will not be covered when it comes to COVID, because those things are going to go bye-bye. Medicaid and Medicare beneficiaries, you absolutely need to check to see if, number one, are you eligible to renew, especially in the case of Medicaid, because that is a very state-specific public insurance plan. And also you need to check to see if your plan, regardless of whether it's public or private, is going to change. You just have to check to see what's going on. And for those who are not insured, getting free stuff is going to end. So this is the time to get vaccinated. It's now before May 11th, because we just don't know what that's going to translate into. And if it translates into our normal state of affairs when it comes to healthcare, there's going to be a price tag associated with it, unfortunately. And so in general, we don't know if testing is going to be covered, likely not. If medications are going to be covered, vaccines, that's going to get commercialized. And so you just got to get it done, before the state of emergency ends, because we just don't know. But
as a med peds doc, do you know, I'm sure you do, I just want you to share with us. I know you know the answer. So like if you have a patient that comes into your office, like let's say it's a, like an 8-year-old kid and they need their vaccines, there are ways to get vaccines paid for the kids so they can have them for free, right? I mean, if they cannot afford them, like even if they don't have some of these services.
Yeah. So
Yeah.
luckily I live in New York.
Yeah.
And all children are eligible for Medicaid in the state. So that's the way to do it. Get them enrolled in Medicaid, you know, and we have right now for the undocumented folks, systems in place for the undocumented folks, so they can get access to care. So
Colorado is very similar, and but I don't think that that's true across all 50.
That is not. That's not true across all 50.
Yeah.
And so yeah, it's gonna mean, you know, there, you know, resources. The whole point of the emergency declaration is to shake money out and to shake resources out in whatever form to direct toward addressing the issue that's the threat. That's the point of declaring the emergency. And once that is rolled back, then the resources and support roll back with it. And so now you are left to deal with the issue that confronts you in a non-emergency state. And so get to know what that's going to look like as soon as you can. Like start to figure it out, start to think about it. You know, if you get sick, where can you go? If you don't have, you know, if you're one of those folks that Medicaid got expanded because of COVID-19, and you became eligible because of COVID-19, are you able to renew? You know, you have to find out. And if you're not able to renew, what are you going to do? Like, how are you going to get your health care, right? Like, what are the safety net systems that you need to tap into? Most states have safety net systems, you know, and you get to know them and figure out how you could get yourself permanent insurance. You know, get as much help as you can. And a lot of the state, if you go to your local health department websites, everybody's on notice about this. Like a lot of places have got on notice. So go to your local health department websites, look them up, look up to see what they're recommending. I know for here in New York State, there are toolkits available for providers to share with their population and their patients. And there are, you know, phone numbers to call for questions. And so, yeah, you have to, things are going to change. That's for sure. Things are going to change. How they're going to change is going to be specific to the plan, the health plan that you have, or don't have, because if you don't have insurance, then obviously all the stuff that came for free, you won't get access to.
The toolkits that you mentioned,
it'll be more difficult to get access to.
Yeah. The toolkits that you mentioned, are those things that physicians like you could provide to your patients?
Yeah.
Okay.
Yeah. Yep.
That's awesome.
Yeah. Yep. Will the end of the public health emergency make the vaccine more or less accessible or free? I think it's going to be less accessible in my view. I don't know how you feel. I think it'll be less accessible. I think, again, the emergency declarations are there to mobilize those resources. So I think they're going to.
Yeah. I mean, I think that
back from where they came, you know,
I think that where you would normally have vaccines available to you, you would still likely be able to get the vaccines, like pharmacies, healthcare clinics, doctors' offices. But, you know, some of those pop-up COVID vaccine clinics that, you know, surfaced, I think, early on, I think they're probably starting to dwindle and, you know, not be rolled out as much, except for Julissa Soto, who was one of our guests.
That's right.
As she mentioned, her energy has not subsided. She's doing pop-up vaccine clinics like freaking all the time around the Denver, Aurora, like Colorado. So if there are people like her all over the country, then we're probably still in luck. But I agree. I think that they're going to become probably only found in most cases at your pharmacies, your healthcare providers, things like that, where vaccines would normally be given.
Right. But I don't know, again, I don't know how free they're going to be.
Right. No. Yeah. They probably.
Yeah. I think that they're going to be, issues with depending on how we do it, like depending on how they decide to go do it. There are a lot of advocates out there to just to say like this should just be picked up. This is not our fault. Like
Right.
this is not the the human
Right.
being's fault, right? Like this is just part of living, and at this point this is part of living, and like we need the tools to be able to fight them, and we shouldn't have to pay for it. And there are advocates out there.
Right.
There are advocates out there, but again, insurance is private. I don't know what's going to happen with the private. We're talking about what's going to happen, with the government funding. Stay tuned. You have to pay attention. And my biggest advice to anybody who's on Medicare, Medicaid, private insurance is to pay attention to your inserts. Like when your health insurance company mails you some updates, read it to see like how does that actually going to affect your coverage for the healthcare that you need. So
yeah, absolutely. I wanted to also add a question, like shift gears a little bit, because I've been reading a lot about this. Oh, hang on, I gotta mute myself for a second. Yeah, so I've been looking this up because we have, my parents are over 65, my husband's parents, so I've been asked a lot about getting an additional dose / AKA booster of the current.
I think we lost this. I think we lost the fight.
Oh, yeah, no, but they were wanting to know if they could get one because they had the Omicron specific version of the vaccine. And they wanted another one because they want to continue to travel and do stuff. And it's been over 6 months since their last one. They're approaching, the 9-month mark where we know the data shows antibodies wane. So it looks to me like FDA is thinking of approving another dose for people who are over 65 or have like immunocompromised or other health issues, but unlikely for us. Those of us that are still in our 30s.
Sorry, I didn't mean to bust out laughing. My bad.
Okay, those of us that are early 40s. I'll end there.
God.
Yeah, it looks
After
like
40 doesn't matter. It all blends together. It's fine.
It does. But yeah, so it looks like that may be coming for people over 65 or with other health conditions, if they want an additional one, like 6 to 9 months out. But I think for the rest of us, it might become the annual in the fall. Yeah, is what it seems like.
I mean, the good news about that is that you could just get flu and COVID at the same time, be done with it.
Yeah, well, I think that's part of the reason why they're considering having it be an annual vaccine and having it be in the fall is that it's easier for people, I think, to be like, if you're getting your annual flu vaccine, you just kind of add at the same time, you go in, it's one. If we were to have this COVID vaccine schedule on every 9 months, that means that we're shifting it. It's just, it's too much, And I think also the uptake of the bivalent version of the vaccine was also much lower than we had hoped. Yeah, definitely. So anyways, I just wanted to add that little bit of, for people who have questions about an additional dose, because it's likely that anyone who's listening to this might have that question. Yeah. Well, listen, we've got millions of listeners, right? So we just. Yeah, I mean, yeah, totally. Amazing. Well, thank you for joining us today.
to talk about this very interesting and topic and up-to-date topic. Honestly, this is stuff that's happening to us now.
Right.
And we hope it was helpful. Let us know, give us some feedback. We're still waiting for some at, you know, Dr. Tony, Dr. Amy at gmail.com.
Yeah. All right. Thank you guys so much. And we'll talk to you next time.